Okay, here we are back with Eric, and since our last videotaping here, we've done quite a bit, haven't we, Eric?
We've done.
And we are right now, we are almost exactly 3 months from the time we began treatment. And again, treatment beginning with the initial stripping between the lower front teeth and the beginning of the orthodontic movement of those teeth. And in our last video shooting, we were kind of in progress, and Eric was starting to feel a little better. His headaches seemed to be improving, and since then, what we've done is we have completed the orthodontics. The final condensation of those lower front teeth has been accomplished. And at that point in time, I'd like to show kind of where Eric was at the end of the orthodontic phase. If you recall, Eric's treatment, we projected from the beginning, Eric's treatment was going to involve primarily orthodontic treatment, but then followed by some additive and reductive reshaping to finalize his occlusal stability. And again, I'll show you where Eric was at the completion of his orthodontic treatment, and then we'll show where he is right now since then. And since that completion, we have gone in and done the reductive reshaping and the additive reshaping to Eric's front teeth. Okay, here we have Eric's models immediately post debracketing, literally just a few days ago. And at this point in time, what we've done is by clearing the upper and lower anterior teeth out of the envelope of function, we've eliminated the constricted function. However, what we have done is we've not created, but we still have not addressed the occlusal dysfunction. And what we see now is that the front teeth are out of the way, that the back teeth still aren't hitting quite evenly. And if we look, when we took Eric's bite relation, his PSCP bite relation, he has a little bit of a hit and slide from the first point of contact until maximum intercuspation. And it's about, from there to there, about a millimeter and a half. And that first point of contact is on the right posterior. So at this point in time, what we did was we literally, if you can recall what we did on Debbie, at this point in time, when we see Eric, we treat Eric at this point exactly the same way we treated Debbie. Okay, and that is that we will go in his case, did the reductive reshaping of the posterior teeth, and then finalize the anterior guidance by doing additive reshaping. Now, because of the time constraints of this video, we're not going to show the detail of doing the equilibration or doing the additive reshaping to Eric's front teeth. But again, if you would go back to and view Debbie's treatment, at this point in time, we treat Eric at this point, now that the constricted function has been resolved, we will treat Eric at this time exactly the same way we treated Debbie. So if you went back and viewed Debbie's tape, you would see what we did to Eric. And just for a point of interest, we can look at this, and if you can take a look here, and we'll show kind of a close-up of Eric's teeth and talk to him here in a moment. But a very nice result. Very nice result. And then again, this was before doing anything additively to finalize the anterior guidance. But this was immediate post-debracketing. And if we look just for comparison, if I can do this without making too much of a mess here. Eric, can you take that for me, please? I'll try and hopefully not get these mixed up here. Just to remember, just to recall where we started with Eric. When we started, at the beginning of treatment, as you recall, we had contact only of Eric's upper and lower anterior teeth. And you can see, although not a large amount of space between the posterior teeth, again, the posterior teeth were completely out of contact. And in the process of doing Eric's orthodontic treatment, the front teeth were taken out of the envelope of function. But at that point in time, then we found, as we would expect, that the back teeth weren't quite hitting evenly. So at that point, we equilibrated them in, and then finalized the relationship for the envelope of function on the anterior teeth with some additive reshaping. Okay, so Eric, tell me since we completed, tell me how things feel. Tell me what your experiences have been.
Since we taken the braces off, my neck doesn't hurt anymore, which is great. We talked about that briefly. And my teeth touch, which they've never really done before.
Now when you say your teeth touch, what are you talking about?
My back teeth.
Your back teeth, okay.
Yeah, definitely.
Okay. Okay.
And they just feel different in a good way.
Yeah.
So I'm real excited about that.
And now Eric has really only been out of brackets for just literally a few days here. And we, of course, will do a follow-up on this in the months or hopefully even years to come if Eric doesn't move out of town here. But in any event, tell me about your front teeth now. Are you at all aware of the front teeth contacting at all now when you close?
I'm aware of things shifting around, but in a good way. As far as I'm not used to my teeth touching the way they have been.
Okay, okay. And when you close, you feel a real solid solid contact
Yes.
of all those posterior teeth.
Yes.
Now again, I should also note here that we really haven't even done the follow-up or reevaluation since I equilibrated Eric a few days ago, and we will be doing that. But literally for the time constraints of getting this video out for you,
Right.
we're doing this right now, and so we can get a completion here date. But let's just show just real quickly here where we're at, and let me glove up here. So again, the main thing to emphasize and understand is at the end of the completion of the orthodontics and the elimination of the constricted function, at that point in time, we have literally treated Eric just as we did Debbie to eliminate the occlusal dysfunction. The one difference between Debbie and Eric is we didn't have the sense of urgency or the problem or concern with the clenching and grinding or the bruxing that Debbie had. And while we refined the envelope of function and wanted to make sure that the upper and lower anterior teeth are not in the way of envelope of function, the excursive movements, those sliding contacts, even into crossovers that we were so very concerned with on Debbie, we did do that on Eric, but in reality is the importance or the critical nature of that probably is not quite so critical for Eric as it was for Debbie. But just let's show here what we have in Eric. You can just go ahead and close down, squeeze. Our goal was I want to have, with maximum biting force, want to have just very light contact of the upper and lower anterior teeth. Squeeze, open, squeeze, open, squeeze. And this is with an 8-micron shim. Squeeze. I'm having this very light, very, very light resistance to this. And that's a very nice situation. And again, if we were, and I'm not going to do it here, but if we were to put Eric through the same exercises that we do with Debbie, with closing and chewing, we would see that number 7 through 10 also are not in contact here. Now, Eric, one thing you might want to do too is, can I show just kind of a close-up of the front teeth here? We did, again, one of Eric's goals was really improve the appearance of his front teeth. And although, again, as I explained to Eric, that in the constraints of what we did, you know, we could achieve a higher level of aesthetics than we did with the composites that we did on Eric. But again, for Eric's goals and his objectives, and he's very happy. So let's get kind of a quick look here. Open here. See if I can do this without pulling your lips off. Okay. Close down. Bite down. Okay. Okay. Open a little bit. And you can see the lower front teeth, upper front teeth. And again, this was a very, very, very conservative treatment. Why would we equilibrate so shortly immediately post-debracketing? What's important to realize is that the equilibration that was done, the reductive reshaping, was really done in the posterior teeth, which really were not orthodontically treated. If you had been in full braces, if you'd been in full orthodontic treatment, we really wouldn't have done the equilibration that we did, the reductive reshaping, until probably about 6 months after debracketing. So at that, I think we're pretty near our completion. Again, for those of you watching this, we will of course follow up on this with Eric. And again, our primary objective with Eric really has been to improve the appearance of his front teeth and to get those front teeth and the back teeth out of the envelope of function. So it's primarily, the primary purpose of this video was for the occlusal therapy and the benefit of the teeth. But one thing to note, which has been kind of a side issue here, is the amount of benefit that we'll see very commonly and very typically in head and neck pain. And if you recall from further back in the video, we mentioned that Eric might need some cervical therapy, some physical therapy on his neck. At this point in time, we haven't done that, and it may or may not be necessary. And we'll follow up on Eric over the next weeks and months to see how those migraine headaches and how some of that neck pain is done. But at this point in time, he's doing really, really well. So, Eric, any questions I can answer for you as we complete here?
I'm fine right now.
Okay, Eric, thanks so much.
Thank you.
And I look forward to seeing you very soon, okay?
Sure, definitely.
Thanks. Thank you.